So hello to all of you and welcome to CEDEES. I'm sure that all of you would agree with me that in our generation, nothing has affected us as much as this particular COVID-19, isn't it? Just imagine now, if you're having a cough or cold, we'll think twice about going to an office, isn't it? You imagine yourself, let's rewind 2 years back. You're sitting in a theater, you're watching a movie, there are hundreds of people around you, you cough and you sneeze. People might look at you once or twice and tell, okay, this guy is having a cold, right? But imagine the situation now, you're coughing and sneezing, you can imagine all those people, what they do to you. You're wearing a mask, you're not wearing a mask, they're just going to pounce on you, right? And we ourselves would feel so guilty. Imagine, a sneeze has become so dangerous now, right? Even if people are walking with a gun, I think people will not bother. But if he's having a cold, then I think people around you will know, they just make way for you. They'll tell, okay, bye, please keep walking. You know, that is how much COVID-19 has affected every layman. Jokes apart, COVID-19 has destroyed a lot of things, right? Families have been devastated, deaths have occurred, loved ones have lost their people. So I'm hoping that, things would fall back into track very soon and things will become better. Let's always be hopeful, and I'm sure that everybody is working left and right, and with everybody's cooperation, we can put an end to COVID-19. Right, now this particular small, I would not call it lecture, I just want to share some information with you, is about a few terms. Right now, if you realize now, the common person, the layman, forget the doctors and the whether you're a dental or you're in the medical profession, the layman has started capturing a few terms. Right? Until 2 years from now, nobody knew that there was something called as PPE. There is something called as quarantine, and all these scans. You can imagine the amount of CT scans, HRCT, or a high resolution CT scans which have been done over the past 2 years. Tremendous increase in amount of CT scans, which is not good, but anyway, but all these things are happening. A few months back, around 3 to 4 months back, I had a neighbor of mine who started developing cough and fever and all that. So he got himself an RT-PCR test done. His doctor also advised him to get a CT scan done, right? And I'll just show you the slide now, just to see how his CT scan is all. This was his report, which was given, right? You see that last part, impression? Let's make it a little bigger. Let's go to the next slide. And this was how it was, right? This is what they had written there. And I would like you to focus on the last line over there. Moderate COVID pneumonia, CT severity score of 10 by 25 and CORADS 5. So what he WhatsApped me and asked me was, Raisen, what exactly is this CORADS 5 or what exactly is this CT severity score of 10 by 25? I have no idea, but I'm scared. I don't know if something is going to happen to me, if my lungs are working, what, That is when, that is how I think, even the common man, even a lay person, needs to understand not just the medical or dental fraternity. And obviously CEDEES, we are the so-called excellent or the masters in dental entrance examinations. So there's no doubt that whether you're a dentico, you're a medico, you have to know it very well. But I think it's very important for a layman to understand what are these terms, because I'm sure so many of you all, I'm sure in your families too, they must have got the CT scans done and you must have seen the CT severity score or CORAD 5. So what exactly do you mean by that, right? For the next 5 to 10 minutes, maybe around 10 minutes max, I think I'm going to speak about these two, and I'm sure that it'll put a little more light if you are not aware of these terms before. Right, so let's move on. Now, for those of you who don't know, our lungs, we have around 5 lobes there. Right, on the right side, we have 3 lobes. We see there is a right upper lobe, right middle lobe, right lower. On the left side, we have left upper and a left lower lobe. So we have 5 lobes in your lungs. Right? This is a basic anatomy. I'm not getting any more into depth into this, but just understand that this is there, because this is important for us to understand our CT severity score, which I'll be coming a little later. Also, whenever you get an HRCT done or a chest CT done, we are trying to majorly focus and understand what's happening to your lungs. What is there, consolidation? Is there some particular problem there? This is what we are really going to focus on. Okay, right. So let's go to the next slide. Before we go ahead and understand the CT scans, and before we go ahead and understand about what is it, what is CORAD 1 or CORAD 2, you have to be very familiar with these terms. So I'm going to start off with these terms like as though you people don't know anything, and so that you understand the basics well, and then you will be able to get to the bottom of it. Right? There are 4 terms which all of us should be very familiar when it comes to a CT scan of a chest. Also, my dear students and everybody who are listening to the lecture, a CT scan is not recommended if you just start off with a common cold or cough. A CT scan is only advised if you are having a moderate to severe, like if you're hospitalized or you're having a moderate to severe symptoms, you're having respiratory embarrassment, or your SpO2 levels are 93 and below, and only then you might be required to go for a chest CT. Simple cough, cold and all these things, no, it's absolutely contraindicated. Okay, right. So terms to be familiar, the first is a ground glass opacity, then we have something called as crazy paving pattern, and then we have consolidation, and then we have something called as a reverse halo sign. If you understand these 4 terms, I think even you can read your CT scan quite well. Right, let's go on with the first one. The next slide. Ground glass opacity. Now, I want you to appreciate this opacities here, this ground glass opacities which you see in your chest CT. See the way they're located there, peripherally. So when you say ground glass opacity, it's something like, you're actually driving a car, and on your the glass there's a fog there. So you can see through what is there, but there is a fog, right? It's small, hazy covering over your windshield, right? So this kind of an appearance is what is called as a ground glass opacity, right? Basically happens simply because that air is displaced and there is inflammation there, right? So that is what is going to basically happen. Air is displaced. So obviously when air is displaced and you have this inflammation there, so this is what is called as a ground glass opacity. It's the basic, and please understand that 98% of people with COVID-19 will have ground glass opacities at one time or the other. 3 words which I would like all of you to remember. One is that most of the ground glass opacities are peripheral. They're located towards the ends. If you can see here, it is peripheral. It could be bilateral, majorly bilateral. It could start off as unilateral, but then you can have it as bilateral. And they are multifocal. Now, if you remember these 3 words, it's very easy for you to understand your COVID CT scans. The first word is peripheral, the second is bilateral, the third is multifocal. I think I'll stop with that. Okay, this is what is meant by a ground glass opacity. Next one. We have a term called crazy paving pattern. I want you to appreciate over here what's happening there. Okay, let's go to the next slide. So you understand what is this crazy paving pattern you must have seen on the footpath, when you're walking. We have these tiles placed in various order. There is no particular order. It's all like that, right? So let's go back to the previous slide. Right, now what do you see here? What do you see here, all of you, is that there is a ground glass opacity. It's something like this. You have a ground glass opacity, and you have these linear streaks which run across. These linear streaks which run across like that is what is called as a crazy paving pattern. It's simply because of alveolar edema and interstitial thickening, right? So again, first you will have a ground glass opacity, and when you have this alveolar edema and interstitial thickening which comes about, you have these linear streaks which are superimposed over your ground glass opacity, which is then what is referred to as a crazy paving pattern. Okay, let's go on to the next appearance. Next, in this appearance, well, this is what is called as consolidation. It's very easy. Now, what you have on the left is the diagram which we saw before, which is ground glass opacity, and what we have here is consolidation. So it's very simple. The word is self-explanatory. So when you see consolidation, the same ground glass opacity which was first hazy now becomes more opaque. You can see in the radiograph there, in the CT scan there, it's very thick, white, opaque, and it's simply because the entire space, your air space which has been filled with air, is now filled with fluid and cells and tissue and all this kind of things, and you're transudate, and that is what is called as consolidation. So that's again a very important feature which comes a little later in COVID-19. The first and the most important is ground glass. You can have crazy paving, Consolidation comes in as the maturation, as the time goes on, right, in COVID-19. This is the third important finding. The next finding is what is called as a reverse halo sign or atoll sign. Can you appreciate this here? There are two small circles which you can appreciate. Now this is called reverse halo or atolls. What are these atolls? Atolls are, let's go to the next slide. So when you say atoll, yeah, this is an atoll. Whether it is Maldives or let's say Bora Bora Islands or whatever, you can see water in the middle, right? And you have this nice coral reef all around. You have this wonderful coral reef all around. So what is this reverse halo? Is that you imagine that water as a ground glass opacity, and there is a nice consolidation which is taking place all around. So it's exactly the opposite of a halo. Halo is when you have a radiolucency over a dense object. This is a reverse halo. So you have the water in the middle, that is you have the ground glass opacity, and around it you have consolidation. Let's go back to the previous slide. Yes. Now I think you can, once you've understood what is an atoll, atolls are small islands which are basically formed by coral reef over water, right? So when you see this here, I think you can appreciate how you have the ground glass in the middle, and all around you have this nice consolidation. You have this white opaque layer. Now this is what is called as a reverse halo sign or atoll sign, right? So if you have been following the lecture till now, we have learned 4 important findings. Ground glass opacity seen in more than 98% of everybody. Of COVID patients. Second important is crazy paving pattern, especially for all the entrance guys. You guys should know these terms well. The third is consolidation, and the fourth is what is called as a reverse halo or atoll sign. So if you all have CT scans, some of you might have CT scans from your relatives, even yours, and if you have taken it, go and see, look if you have these kind of findings there. Okay, right. The next one, let's go on. So according to the various articles, there are 4 important features when you're looking into a CT scan. I'm not sure you can read each of it, but I just want you to know what is there on the left side. One is what is called as a typical appearance. Then we have indeterminate appearance, atypical appearance, and negative. Typical is what we have learned till now. Typical is all these 4. What? Ground glass opacities, crazy paving pattern, consolidation, reverse atoll sign, and most of the ground glass opacities are located peripherally. They are probably bilateral, and they could be multifocal, right? The next one is indeterminate. When I say indeterminate, it means it could be seen in COVID, but they're not, they do not really specify that it is COVID. It could be seen in COVID. What is there? They are unilateral ground glass opacities, not bilateral, but unilateral ground glass opacities. Another important feature is ground glass opacities in COVID are usually rounded. They're like this, nice round shape. But you can have indeterminate appearance. Sometimes they are not very rounded also. A patient could be COVID positive, so you don't have this typical rounded ground glass opacities. You can have little, vague, odd shapes too. The third one is atypical. Now this is important. Atypical means the patient has a lot of chest CT findings, but they are 100%, they do not signify that the patient has COVID-19. A very important finding is something called as centrilobular tree in bud appearance. I'll explain, I'll show you the diagrams. Tree in bud appearance is very characteristic of, let's say, bacterial infections. And you can also have, pleural effusions, you can have cavitations. None of this are features of COVID. They're either got to do with tuberculosis and various other diseases. Okay, so typical, indeterminate, atypical, negative. Typical is what we have already learned about. Let's go to the next slide. Right, now coming back to CORADS, what exactly CORADS is? CORAD is a term which is given by the Dutch Radiological Society. CORAD stands for COVID-19 Reporting and Data System. COVID-19 Reporting and Data System. This was based on the earlier systems which are already there. If you see those names there, first one, LIRADS. LIRADS means Lung Imaging Reporting and Data System. PIRADS. PIRADS is Prostate Imaging, so and so. BIRADS is Breast Imaging. RADS is common for all. It is Reporting and Data System. So based on this, they came up with the Dutch Radiological Society came up with what is called as CORADS. So this is what is your CORAD score. Now, CORAD again, let me repeat, is COVID-19 Reporting and Data System. A very important feature of CORADS is this. Whenever you take a chest CT scan, Whenever they tell you CORAD 1, 2, 3, 4, it does not tell that you have COVID. Please note that CORADS is not for diagnosis. Your chest CT scan as such, this CORAD score is only for knowing the suspicion. You may or you may not have COVID. The higher the CORAD score, you most probably have COVID. So it is about the level of suspicion. It is not about diagnosis. For diagnosis, you have to go for your RT-PCR testing only. CORADS or chest CT is not for diagnostic purpose, right? It's only a suspicion. Okay, higher the CORAD score, more the chances of him or her having COVID. Let's go on. So what exactly, there are 6 scores in CORAD, 0, 1, 2, 3, 4, 5, 6. Let's understand this first. 0 is when the scan has not come well, so we will not bother. Okay. 1, very low chances of him having COVID. Usually the chest scan is very normal, or he could have some other disease, right? Some other disease. 2 is low chances of him having COVID. Why? Remember those things I told you, tree in bud appearance, cavitation. So these are people having certain other diseases which are very characteristic of other diseases, and you're sure that he's most probably not having COVID, he has something else. That is 2. Now the suspicion of COVID starts increasing from 3 onwards. That means to say, the minute it is 3, it is equivocal or unsure. That means to say, patients start showing some features of COVID-19, certain ground class obesities. He may show a little bit of crazy paving pattern somewhere. Some amount of densities will come around at the peripheral edges, but you're not sure if it is COVID or not. And that kind of, then it's called CORAD 3, right? CORAD 4 is a high level of suspicion for COVID-19. All these findings, what I've already mentioned before, will start being visible, but not very clear. You cannot be very sure. If you're giving CORAD 4, that means it's almost, the patient almost has COVID, but maybe, it could be something else also. There's small doubt in the doctor's mind. The next one is CORAD 5, when you're very sure, okay, all the findings are there, there's no doubt this person has COVID, and that is when you say that it is typical for COVID-19. All the COVID-19 features, whatever we have mentioned before, everything is present. That means it is 5. So what do you understand in this CORAD score? 0, 1, 2 have got nothing to do with COVID. 3, so. 4, the chances of the suspicion level of having COVID is very high. CORAD 5, 100% COVID. Again, for diagnosis, you have to get an RT-PCR done. But this will give you all the features of COVID-19 is there, and you start taking care, right? 6 is not per se. 6 is a person already has an RT-PCR, he's already positive, he's been diagnosed as a COVID patient, and then you get a chest CT scan. So whatever findings you get, you just corroborate. So he's already positive, you get this you get the findings, so you put it as CORAD 6. We're not bothered about the findings because it's already positive. You got to treat him as a positive COVID patient. Right? You imagine a patient has been admitted today in the hospital, is not really able to breathe well. You go for an RT-PCR. RT-PCR result may take 1 day, may take 2 days sometimes. Of course, in certain very good hospitals, sometimes very good tertiary care centers, you may get it immediately, right? Immediately in the sense, let's say, the same day, right? But a chest CT scan is much faster, and that's the reason. And immediately you see all those consolidations and all that. That okay, I have to really take care about this patient. You put him on emergency treatment as soon as possible, right? So that is about CORAD. I hope you're understanding this, right? So let's go one by one as to what is CORAD 1, 2, 3, 4. I'll show you some scans so you understand it. Now this is CORADS 1. Everything looks normal. No ground glass, no crazy paving, perfectly smooth. He has certain other disease. He has a congestive cardiac failure and all that, but his lungs is everything fine. Okay, let's go to the next one. Now if you see this, you see that there is some kind of a consolidation there, but again this is unifocal, it's only on one side. But if you go above, there is an appearance here which is very characteristic of bacterial infections. This is called as a tree in bud appearance. Let's go to the next slide. Now this is what is meant by a tree in bud appearance, a shape like that. It comes off, you have this radio opacities like this, it comes out like this. This is a tree in bud appearance. Let's go to the next slide again. So when you see here, this is an enlarged part of that. It comes out, can you see that? It looks like it's branching off here and there, and you see the small radio opacity here and there. This is very characteristic of bacterial infections. So when you see that the patient is having a respiratory embarrassment, he's having these problems, tree in bud appearance, it's usually a bacterial infection. Okay. All those who are listening to the lecture, my dear students, we are not radiologists. This is just a rough guideline, okay, as to what is going on, okay? Right, so this is what is called as a tree in bud appearance. It has got nothing to do with COVID-19, right? Let's go on. Now we go to the next slide. Now this is what we see here. We see this nice big black circle there, and that is what is called cavitations. Let's go to the next slide. There is also again an image of cavitation. All this indicate tuberculosis. It's got nothing to do with the patient is not able to breathe properly. This cavitation is a hallmark of tuberculosis. It's got nothing to do with, again, COVID-19. Right? Let's go to the next one. CORAD 3. Now, what did we learn about CORAD 3? CORAD 3 is unsure. The physician is like, your radiologist is like, okay, I'm not very sure. It could be, could not be, things like that, right? So what you see here is that there are these ground glass opacities. I'm not very sure if you can appreciate it on the image there, but you can have these ground glass opacities, small opacities are coming out. So this is what is called CORAD 3. It could be bilateral at this stage. Next one. This is CORADS 4. You have proper ground glass opacities which can be appreciated in these images. They're not per se peripheral. We call it peripheral or subpleural. So they're not exactly at the periphery. They are some almost there, but really not there. And we don't know what's happened to the other side. But there is this nice ground glass opacity spreading out and all that. So it could be a very high level of suspicion of COVID-19. So you give it as CORAD 4. Let's go to the next one. Now this is a very classic case of CORAD 5. That means all features are there. If you look at the first image on the above, both the sides he has proper ground glass opacities. There are consolidation, a small part here and there which can be seen. If you see at the bottom, there is no doubt there is ground glass opacity there. There is proper consolidation there. The whole thing is consolidation. You can also have vascular thickenings. We can see those nice radiopaque lines. There is vascular thickenings which can be seen. Very, very characteristic, all typical findings. And see how they are completely peripheral, bilateral, multifocal, you name it, everything is there. The physician has no doubt, no suspicion, typical for COVID-19, you give a seal, CORAD 5, end of story. Right? I'm hoping that you've understood this now. It's very simple. CORAD is COVID-19 Reporting and Data System. Dutch Radiological Society have given this. Please understand, it is only to know your level of, the physician will tell you that, okay, I suspect this could be COVID-19. I suspect this could be so-and-so. So it is like that, okay? 0, 1, 2 has got nothing to do with COVID. 3, unsure. 4, high. 5, very high level, right? 6, the patient already has RT-PCR. So whatever finding comes, you just write it down. So that is what is called CORAD 6. Even if he has one unifocal, he might have atypical appearances also. It's very rare, but he may have. So that is what is called CORAD 6. Right. Now, once you've understood that, that's one part of today's small talk. So we'll go on to what is called as a chest severity score. So again, a CORAD score does not give you severity. It neither gives you diagnosis, but it just tells you how the findings are right now in the patient. Okay. And so they wanted something which is more objective. They wanted a chest severity score. So there are different authors who came about. But what is very popularly followed, especially in our country, was given by Lee et al. Okay, let's go to the next slide. Lee et al. Now what this person has done, now each of those lobes, let's say one lobe, okay, let me take one lobe like this. This is one lobe, let's say the right upper lobe. So what he does is he looks into it. He sees the amount of ground glass appearance there and amount of consolidations he has there or whatever. He looks into all that and he gives a particular score. It's divided as 1 to 5, as can be seen in the slide for you. 1 is when the lobar involvement, each lobe, okay. 1 is when the lobar involvement is less than 5. 2, 5 to 25. 3, 26 to 50. 4, 51 to 75, and 5 greater than 75. So let us say that you are the radiologist. You're looking at this lobe and you feel, okay, this is very high. I think this is greater than 75% involvement. So I'll give a rating of 5 for this guy. So for one lobe, he has given a rating of 5. So what he does is he counts the rating in all the lobes, right? Let us say the right upper lobe, he has given 5. Next he gives, let's say 3. Then he gives 2. You go to the left side. Again you give, let's say 5. And then let's say you give 1 or so. And then you add them up. So 5 plus 3, 8, 8 plus 2, 10, 10 plus 5, 15, 15 plus 1, 16. So the total is, I hope you get that right. For how many lobes do we have? 5 lobes. What is the maximum score for a lobe? 5. 5 into 5 is 25. So for this patient, his score is 16 by 25. This is how you calculate the CT severity score. I hope you understand the first the report which my neighbor had received. So he had a COVID chest severity score, I think, of 11 or by 25 or so, and his CORAD was 5. That means all typical findings of COVID-19 were there. CT severity score, I think, was given as 11 by 25. I hope you're understanding what is 25 and what is that 1, 2, 3, 4, 5 for every lobe, right? Let's go on. I'll give you certain examples. Next slide. Okay, now if you look into this particular CT scan, everything is pretty smooth and pretty clear. You don't have any ground glass, this, that, everything looks fine, right? Let's go to the next one. Now in this case, you see only the middle one, there are some small flecks here and there. So you give it, rest everything is smooth. So you call it as score as 1 because it is lower than 5% of lobar involvement, lung involvement. Next. 5 to 25. Slightly more involvement if you observe the second slide. Next one. 26 to 50%. Look at this particular image. You can find this nice ground glass opacity is there. 26 to 50%, that is CT score of 3. Next one. CT score of 4. Okay, now this pillar looks okay, but this has got involvement. This has got more involvement, but roughly he has given an overall score. When looking at the lobe from all sides, he has given a score of 51 to 75. That means he has given a CT score of 4. Next one. Now, if you look into this, it's complete involvement from all the sides. Okay, this is completely gone. This is also almost 75-80%. And here also you have nice ground glass opacities. You hardly have this black radiolucence. It's completely almost radiopaque. There's no doubt that this is greater than 75%. So this is a score of 5. So ultimately you add up everything and you get a score. And what do you interpret based on that score? Let's go to the next slide. So based on that score, it's very simple. If the patient has scored lower than 8, you add up everything and it comes lower than 8, that means he is a mild category. Severity is classified as mild. If it is 9 to 15, you classify it as moderate. If it is greater than 15, then you call it as severe. So this patient whom we have calculated, it is 16 by 25. That means CT severity tells you, okay, it is 16, it's very severe, and CORAD score 5, be careful. For my neighbor, I think it was 11 by 25 or so. That means he comes in what is called as a moderate CT severity, but he had all the typical findings of COVID-19. So he was given a CORAD 5, right? I'm hoping that I was able to justify and make you understand a little bit about what is CORADS and what is the CT severity score. Especially for students who are appearing for entrance exams, they can give you these kind of CT images. They can ask you to calculate maybe the CT score. They can also ask you to interpret the CORAD scoring. They can show you ground glass. They can show you crazy paving. They can show you consolidation. They can show you, the reverse halo sign or atoll sign. And I think all this you should be very thorough. Let's go through a case. Next slide. Right. Now, this is a case of color spectrum when they have taken out for a patient with CORAD 5, and they have seen, you look at the amount of consolidation on both the sides, periphery. It's completely, it's packed up. You can see all this green color will tell you everything, how much of the lobe was involved. Okay. Next. Right. This is how the CT changes over time. So a lot depends on when the patient comes to you. If the patient has come within the first 0 to 4 days, right, where he only have ground glass opacity, partial crazy paving, and the number of lobe involvement is also less. So you might probably give a CORAD score of 3, right? But again, it also depends, and if the patient has come too early, right? Now look at the next one. Progressive stage is when it's 5 to 8 days into the infection, and that is when you start seeing features. Ground glass opacity becomes more rounded, it starts becoming more bilateral, it starts spreading more, right? And you have an increased crazy paving pattern. Consolidation comes in at the peak stage, which is roughly around 10 to 13 days. Again, this is very relative and varies from patient to patient. 10 to 13 days is consolidation. I think I've told you what is consolidation. The entire air spaces are packed with fluid and water and tissue spaces and cells and all that, and once it has reached the consolidation, the body gets in, and slowly, after that, there is a gradual phase of resolution, and articles have shown that sometimes it takes 4 to even 6 months for resolution. There was an article in 2020, last December, whom that followed patients for almost 4 months, and still there were streaks of consolidation. There was still ground glass opacity. That means what has happened to your lungs after once a COVID infection has taken place does not resolve immediately. Well, let's see a patient who see how the CT findings are changing over time. The first one was the CT scan was taken at 4 days when he comes to you. That means very mild. Look at the ground glass opacity, very small ground glass opacity. If it does not come back again and he goes back, you cannot really follow. Now this patient, this is an article, written in I think December 2020 again. Look at it on the 8th day. We can appreciate how the ground glass opacity is becoming bigger and it's nice rounded shape. But it's not yet bilateral, it's still on one side. Next. When it comes to 12 days, it's almost reaching a peak. It's almost reaching a peak. That means ground glass is going away. Not going away. Ground glass will be replaced with consolidation in some time, right? Now, if you look at this, on the 12th day, we can find the particular ground glass, how much bigger it has become. And now it has started appearing, on both sides. You can find small nodules which can be seen there. And look at the 18th day, proper consolidation has taken place. And linear streaks can be seen here and there. This is what has happened on the 18th day. If the patient has reached the 18th day, that means the process of resolution has already started. Right? Let's go to the next scan. Now this is on the 26th day. We find that it's almost clearing out. All that the patient has is small linear streaks, but not yet completely gone. Next. 38th day, that much amount of consolidation and streaks are still there, but it is much lesser than what was there on the 26th day. Can you see that? And they've also seen, they followed up for a period of 4 months, and they've still seen a little amount of, the particular ground glass opacity and everything still there. That means it takes some time for the COVID to be completely wiped out from the lungs too. It's not that you have recovered and everything is back to normal. It does not happen like that. It takes time. Nature has to play its own course. Okay, all of you. So I think this is it about for today's small talk. It is basically about making you all understand what is CORADS, so we can interpret a chest CT scan. Also, please remember the first choice of investigation is usually a chest X-ray. We don't go in for a CT scan immediately, but what we see is that a lot of CT scans are being done, obviously because it's more sensitive than a chest X-ray, but the amount of radiation exposure again is also very high. You get to know a lot of stuff, but it's always very prudent to keep chest CT scans only for people who are hospitalized, who are having respiratory symptoms, or who are in the risk factors, like who are above 60, immunocompromised, you're diabetic, and you're having previous cardiovascular problems. Only then you can probably go in for a chest CT. Okay, for mild, simple cases, cold and cough, no, absolutely not required. And even if you get the finding, it will not be accurate enough. Right? So that is what CORAD score is all about. What is CT severity score all about? I'm hoping that I've made the session quite interesting, and hope you have understood what is going on. Thank you so much. Bye-bye.